Prime Minister chairs joint meeting of Empower groups constituted for planning and ensuring implementation of COVID-19 response activities across the country, reviews preparedness and directs officials to ensure sufficient production, procurement and availability of all essential medical equipment. %30% of total COVID-19 cases across the country linked to Tablighi Jamaat, with 1,023 positive cases from 17 states. Home Ministry says through a massive effort, around 22,000 Tablighi Jamaat workers and their contacts stand quarantined. Power Ministry issues clarification on rumours of massive power grid failure due to turning off lights at 9 p.m. for 9 minutes. Says no need to worry as adequate protocols are in place to handle variation in demand. Says there is no call to turn off street lights and home appliances. Active COVID-19 cases in India rise to 2,784 with 212 recoveries and 75 deaths. Health Ministry issues document outlining action plan in case of a large outbreak of COVID-19. Approach includes geographic quarantine and cluster containment strategy, lays out required institutional. And global COVID-19 cases cross 11 lakh mark with nearly 61,000 deaths. US registers 1,480 deaths in a day. Prime Minister Modi holds extensive telephonic conversation with President Donald Trump. Both leaders agreed to deploy full strength of India-US partnership to fight the pandemic. Namaskar, I'm Abhishek Mahajan. We are in with latest on DD News and DD India. Let's start with our top story tonight. Prime Minister Narendra Modi chaired a meeting of various Empower groups set up to respond to the coronavirus threat and directed officials to ensure sufficient availability of all essential medical equipment such as personal protective equipment, masks, gloves and ventilators. So in a series of tweets, the Prime Minister's office said that PM reviewed the countrywide preparedness regarding availability of hospitals, proper isolation and quarantine facilities, as well as disease surveillance, testing and critical care training. Further, PM also directed the concerned groups and officials to ensure sufficient production, procurement and availability of all essential medical equipment such as PPEs. So amid a countrywide lockdown due to COVID-19, Prime Minister Narendra Modi will interact with floor leaders of various political parties via a video link on April 8th, that is Wednesday. Prime Minister Modi will interact with floor leaders of all those parties who have more than 5 MPs in both houses of the parliament on April 8th at 11 a.m. The video conference pertains to COVID-19 related issues. Moving on, Prime Minister Narendra Modi and US President Donald Trump on Saturday held a detailed discussion on the situation arising out of the coronavirus outbreak and resolve to deploy the full strength of the India-US partnership to fight the pandemic. The two leaders held an extensive telephonic conversation. PM Modi tweeted, and I quote, "We had a good discussion and agreed to deploy the full strength of the India-US partnership to fight COVID-19. The discussion comes at a time when both countries are in the grip of the COVID-19 pandemic. The US has so far confirmed 278,458 cases of COVID-19 and more than 7,100 deaths. India has 3,072 coronavirus cases and has reported 75 deaths. In view of Right, to give more inputs on this, my colleague Abhishek Jha joins me live. Abhishek, we know that President Trump and Prime Minister Narendra Modi, they share a great bond with each other. And that discussion to deploy the full strength of the India-US partnership to fight coronavirus, or we call it COVID-19, comes at a time when both the countries are in the grip of a global pandemic.
Exactly, Vedant. You see, the worst thing is that this pandemic is not centered around one part or one region in the world. This is a global pandemic. At the same time, countrywide, you see almost not a single country around the world of a scale of like a good population and a larger business interest is right now, which is not impacted by this COVID-19 pandemic. So now we are seeing that Prime Minister has been taking initiatives to bring on more, other countries also who are fighting with the pandemic. At the same time, we have seen that Prime Minister's initiative of taking along SARC members and creating a SARC fund, especially dedicated to fight this corona thing. Also, India has been extending its helping hand in terms of doctors, medical experts, and few medical necessities also to its neighbors. And the G20 meeting was also initiated by, it was the idea of Prime Minister Modi, which the world leaders appreciated, and then historic virtual G20 meeting happened where the world leaders discussed about the global pandemic and how to deal with it. Prime Minister has also been taking bilateral telephonic conversation. Yesterday we saw that Prime Minister had a telephonic conversation with the Prime Minister. Then he had also a conversation with Angela Merkel, German Chancellor. Then Prime Minister also talked with some Gulf country leaders. So Prime Minister Narendra Modi is continuously in touch with other world leaders to know how the world is dealing with this crisis, to know how the world can unitedly deal with this crisis while sharing each other's expertise, while sharing each other's technology. And there is always a learning experience also, because this pandemic, though it is being spread and tackled around the world at the same time, but the scale is different, partially like 2, 3, 4, 6 weeks ahead, or 2, 3, 4, 6 weeks behind. Like we see in USA, the situation is pretty bad. Over 1 lakh people having infected with COVID disease, and there are thousands of deaths also. So we can also have a learning how USA is dealing with it. At the same time, USA can have some learning that how Prime Minister is handling this 130 crore population at the same time, while keeping them in lockdown and providing them with essentials and not letting this disease spread across this country. So there are learning, there are sharing experiences with each other while talking to world leaders. And of course, there is a global scale of this disease, and the world needs to come together and fight along.
Absolutely, Abhishek. And President Trump has warned of a very, very painful first 2 weeks of April. Thanks for your inputs. Moving on, in view of Prime Minister's appeal to show solidarity over COVID-19 by switching off lights at 9 p.m. for 9 minutes tomorrow, that is 5th April, Power Ministry has assured that adequate protocols arrangements are in place to handle the variation in demand when people switch off their lights. At the same time, Power Ministry has clarified that the appeal by PM concerns voluntarily switch off lights only, and there is no call to switch off either street light or appliances like TV, refrigerator or AC. Further, Centre has said that local bodies are advised to keep street lights on to avoid any law and order problems. The lights in hospitals and other essential services will remain on. Moving on, Union Ministry of Health and Family Welfare has released the latest figures on COVID-19 situation in the country. In the latest release, Health Ministry said that total number of COVID-19 has risen to 3,072 and death toll mounted to 75. At least 1,023 confirmed cases of infection have been found to be linked to Tablighi Jamaat congregation in New Delhi last month, but massive efforts by various authorities have led to nearly 22,000 people linked to the religious grouping and their primary contacts getting quarantined. The Tablighi-linked infections found across 17 states, including Tamil Nadu, Delhi, Andhra Pradesh and Uttar Pradesh, showed that almost 30% of them are from one particular place. And as many as 108 doctors, nurses and other paramedical staff at Delhi's Gangaram Hospital have been put in quarantine after they came in contact with 2 patients who in their second test report were found positive for COVID-19. Of the 108, 85 are in home quarantine and 23 in the hospital. Moving on, Union Health Minister Dr. Harshvardhan visited COVID-19 dedicated facility at Lok Nayak Jayaprakash Narayan Hospital in the national capital today. The Health Minister met officials at Lok Nayak Jayaprakash Narayan Hospital to discuss the situation of COVID-19. He said there are 1,500 beds at the hospital and there are 290 COVID-19 positive or suspected cases admitted here.
लोकनायक अस्पताल में लगभग 2000 बेड्स की व्यवस्था की गई है, जिसमें 1500 बेड्स तो लोकनायक अस्पताल में और 500 बेड्स जीबी पंत हॉस्पिटल में। इस समय मैंने देखा कि यहाँ करीब 290 कोविड के पॉजिटिव या सस्पेक्टेड ऐसे कुल मिला के मरीज एडमिट हैं, जिसमें से 5 मरीज आईसीयू में हैं। वो थोड़ा सा उनको ऑक्सीजन सपोर्ट पर है, वेंटिलेटर इत्यादि पर नहीं है। मैं होम मिनिस्ट्री को निश्चित रूप से बधाई देना चाहता हूं कि उन्होंने कल निर्णय लिया है कि एनएसए के कानून के अंतर्गत ऐसे लोग जो हमारे डॉक्टर्स को या हमारे हेल्थ सिस्टम के साथियों को जो कि कोरोना वायरस वॉरियर्स की तरह काम कर रहे हैं, अगर कोई भी टारगेट करेगा तो उसके खिलाफ सख्त से सख्त कानून इस्तेमाल किया जाएगा।
Also, Ladakh Lieutenant Governor R.K. Mathur chaired a high-level meeting with senior officers and took stock of Union Territory's fight against COVID-19. He appreciated the exemplary resolve and cooperation by the public during the lockdown and lauded the services of medical and health departments for curing 9 positive cases in Ladakh. Later, the LG urged people to light candles at 9 p.m. on April 5th to show their strength of unity in the fight against COVID-19.
कोविड-19 महामारी को लेकर प्रधानमंत्री का समस्त देशवासियों से कल की गई अपील को दोहराते हुए मैं सभी लद्दाख के निवासियों से एकजुट होकर 5 अप्रैल रात 9 बजे 9 मिनट के लिए अपने घर की सभी लाइटें बंद करके अपने घरों के बाहर या बालकनी में मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट से रोशनी करने का आग्रह करता हूं। इस आयोजन के समय किसी को भी कहीं पर भी एकत्रित नहीं होना है। अपने घर में ही रहकर सामूहिक शक्ति की विराटता, इसकी भव्यता और दिव्यता की अनुभूति करना आवश्यक है। उस उजाले में हम यह संकल्प करें कि हम अकेले नहीं हैं। अंत में मैं आप सबसे कहना चाहता हूं कि आप अपने घरों में रहें, सुरक्षित रहें, मास्क का प्रयोग करें जब भी बाहर निकलें। इस लॉकडाउन को अपने परिवार के साथ अनुशासन पर्व की तरह मनाएं।
So, urging people there to light candles at 9 p.m. Moving on, Indian Railways has clarified that it has not issued any restoration plan with train details and frequency of passenger trains. It said media reports on resumption of passenger services are not based on facts. Indian Railways further said that all concerned would be duly informed about any further decision in this regard. And now the Health Ministry has issued an advisory on use of homemade protective cover for face and mouth. The ministry said that we are aware that social distancing and personal hygiene are keys to prevent COVID-19 infections. Certain countries have claimed benefits of homemade face cover for the general public. Such homemade face cover is a good method for maintaining personal hygiene. Therefore, it is suggested that such people who are not suffering from medical conditions or having breathing difficulties may use the handmade reusable face cover, particularly when they step out of their house. Homemade face cover is not recommended for either health workers or those working with or in contact with COVID-19 patients or are patient themselves. It is advised that 2 sets of such face covers be made so that one can be washed while the other is used. Such face covers should also not be thrown anywhere but kept safely, washed properly with soap and hot water and dried properly before they are used again. There must not be a sharing of these face covers. And now our correspondent Nitendra Singh talked to Ayushman Bharat CEO Indu Bhushan on government's preparedness in the fight against COVID-19 in the country.
जो इस समय कोविड के मरीज हैं उनका टेस्टिंग और ट्रीटमेंट सरकारी अस्पतालों में हो रहा है और वो फ्री है। अभी हाल में ICMR ने प्राइवेट लैब्स को खोला है। तो ये जो निर्णय लिया गया है उसका उद्देश्य ये है कि जो टेस्टिंग है उसको थोड़ा बढ़ाया जाए। जहां पब्लिक सेक्टर है उसको बढ़ाएं और प्राइवेट सेक्टर को भी बढ़ाएं।
So, Ministry of Home Affairs has clarified on ground level issues being faced by states in ensuring smooth flow of supply chain of essential items during national lockdown to fight COVID-19. States have been advised to brief district authorities and field agencies to avoid ambiguity at ground level production, warehousing and transport of essential goods such as food, groceries, fruits and vegetables, dairy and milk products are included under exceptions in the guidelines. Taking the case of laboratories, the communication clarifies that they have been exempted from lockdown restrictions. This includes the testing laboratories in the private sector for COVID-19 samples. Queries have been received as to what constitutes food and grocery. States and union territories have been advised to interpret the terms to mean all items of food and grocery that are usually consumed by people on day-to-day basis. Operations of railways, airports and seaports for cargo movement, relief and evacuation is allowed under the guidelines. Interstate and intrastate movement of all trucks and other goods carrier vehicles with one driver and one additional person is allowed as long as the driver is carrying a valid driver's license. Also, Ministry of Home Affairs has issued fourth addendum to the guidelines issued register amid 21-day lockdown to exempt shops of agricultural machinery, its spare parts and repair, truck repair shops on highways, tea industry, including plantations with maximum 50% workers. And now the Indian civil services have all joined hands to support and supplement the unwavering efforts of the government under Prime Minister Narendra Modi in combating the coronavirus pandemic. 14 central service associations have operationalized a technology platform called Karuna for supporting the measures and initiatives being taken by both center and state governments. Karuna, an acronym for Civil Services Association, reached to support in natural disasters, is a permanent technology platform for providing real-time information and support to the field functionaries. The first online meeting of service associations and members was held on April 3rd under the chairpersonship of Director LBSNAA Dr. Sanjeev Chopra. President, secretaries and other office bearers of various service associations such as IAS, IPS, IFS, Revenue, Customs, Postal, Railways and the Indian Information Services attended the meeting. Dr. Chopra said the platform has already created a 10-day action plan for operationalization of support to both governments and field level functionaries. Karuna would be submitting its first outcome report to the government on April 15th. The Civil Services Officers Institute has made a contribution of Rs 25 lakh to the Prime Minister Cares Relief Fund for providing assistance to those impacted by the pandemic. The number of people who have died from the COVID-19 illness in France jumped by 61% to 6,507 over 2 days, which means a new high of 588 in a day after data from nursing homes were included, and confirmed cases jumped by 44% to 82,165. The Health Ministry reported on Friday, making France the 5th country to report more cases than China. Citing the figures involved, Public Health Chief Jérôme Salomon added that a total of 1,416 deaths in care homes have to date been reported since the beginning of the epidemic. Salomon also said that public PCR testing has confirmed 64,338 cases of the novel coronavirus, with 5,233 added in the last 24 hours. And New York City Emergency Management on Friday has released drone footage of the Jacob K. Javits Convention Center, a venue used by New York Comic-Con and the New York International Auto Show as a makeshift hospital. The U.S. military and federal personnel will operate the hospital to help the city grapple with a flood of COVID-19 patients. New York has become the epicenter of the U.S. epidemic with more than 47,000 confirmed cases in the city. Grave situation. Moving on, cricketers and Bollywood stars have appealed to the people to support government efforts in fighting COVID-19 and obey the lockdown rules.
हाँ, घर में रहेगा देश. हाँ, घर में रहेगा देश. इस देश को प्यार बुजुर्गों से, यहां खुद से पहले अपने हैं. इस देश को प्यार बुजुर्गों से, यहां खुद से पहले अपने हैं. कर्तव्य यहां पहले आता और बाद में आते सपने हैं. बस यही एक संदेश. हां, घर में रहेगा देश. 21 दिन का उपवास लिए, 21 दिन का उपवास लिए, जीवन की लंबी सांस लिए, सीमा रेखा ना तोड़ेंगे, एक संयम, एक विश्वास लिए. चलो मन को दें आदेश. हां, घर में रहेगा देश. संकल्प नया एक करते हैं, चलो मिलकर पीड़ा हरते हैं. संकल्प नया एक करते हैं, चलो मिलकर पीड़ा हरते हैं. इस देश के रहने वाले तो हर दिन ही तपस्या करते हैं. बढ़ जाने दो ये केश. हां, घर में रहेगा देश. हां, घर में रहेगा देश.
नमस्कार. हमारे माननीय प्रधानमंत्री श्री नरेंद्र भाई मोदी ने एक वीडियो क्लिप के द्वारा हमें संदेश दिया है कि इस संडे यानी कि इस रविवार को 5 अप्रैल को रात को 9 बजे 9 मिनट के लिए हम दीप प्रगटाएं और रोशनी करें. वो चाहे आप दिया करें या मोमबत्ती करें, लेकिन रोशनी ज़रूर करिए. मैं ज़रूर करने वाली हूँ अपने परिवार के साथ. आप भी करिएगा. धन्यवाद.
नमस्ते, मैं हूं अनन्या पांडे. कोरोना वायरस एक बहुत ही गंभीर स्थिति है और इस वक्त सकारात्मक रहना महत्वपूर्ण है. हम घर बैठकर बहुत सारी चीज़ें कर सकते हैं जो हमारी मानसिक स्थिति को पॉजिटिव रखे. जैसे मैं अपने परिवार के साथ वक्त बिता रही हूँ, अपने कुत्तों के साथ वक्त बिता रही हूँ, मैं फिल्में देख रही हूँ, किताबें पढ़ रही हूँ, घर पर एक्सरसाइज करने की कोशिश कर रही हूँ, खाना पकाने की कोशिश कर रही हूँ. तो हमें चीज़ें करनी चाहिए जो हमें पॉजिटिव रखे. इस समय में हम एक दूसरे से मिल नहीं पा रहे हैं, पर इसका मतलब नहीं कि हम अकेले हैं. हमें एक साथ कोरोना वायरस को हराना है. हमें सुरक्षित रहना है, सकारात्मक रहने की कोशिश करनी है, हाइजीनिक रहना है और मोस्ट इम्पॉर्टेंटली घर पर रहना है. जय हिंद.
सत श्री अकाल जी सारिਆਂ ਨੂੰ. मैं सुनंदा. इस समय कुल संसार एक मुश्किल घड़ी चों निकल रहा है और इस मुश्किल घड़ी का ਅਸੀਂ ਸਾਰੇ एकजुट होकर सामना कर सकते हैं. डॉक्टर्स वालों जो भी प्रिकॉशनस, जो भी रूल्स ਸਾਡੇ ਲਈ ਬਣਾਏ ਜਾ ਰਹੇ ਆ, ਸਾਨੂੰ ਉਹਨਾਂ ਸਾਰਿਆਂ ਨੂੰ ਫੋਲੋ ਕਰਨਾ ਚਾਹੀਦਾ. ਉਹਨਾਂ ਨੂੰ ਫੋਲੋ ਕਰਕੇ ਅਸੀਂ ਆਪਣੀ ਹੀ ਮਦਦ ਕਰ ਰਹੇ ਹਾਂ, ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਸੇਫ ਕਰ ਰਹੇ ਹਾਂ. ਔਰ ਇਹ ਜੋ ਸਮਾਂ ਸਾਨੂੰ ਮਿਲਿਆ ਹੈ, ਕਈ ਵਾਰੀ ਅਸੀਂ ਸਹਿਜ ਸੁਭਾਅ ਕਹਿ ਦਿੰਦੇ ਮੇਰੇ ਕੋਲ ਸਮਾਂ ਹੁੰਦਾ ਤਾਂ ਮੈਂ ਇਹ ਚੀਜ਼ ਕਰ ਸਕਦਾ ਸੀ, ਮੇਰੇ ਕੋਲ ਸਮਾਂ ਹੋਵੇ ਤਾਂ ਮੈਂ ਆਹ ਚੀਜ਼ ਬੜੀ ਵਧੀਆ ਕਰ ਸਕਦਾ. ਸੋ ਇਹ ਉਹ ਸਮਾਂ ਹੈ. ਇਹਨੂੰ ਪੋਜ਼ਿਟਿਵਲੀ ਦੇਖਦੇ ਹੋਏ, ਆਪਣੀ ਸਿਹਤ ਦਾ ਧਿਆਨ ਰੱਖਦੇ ਹੋਏ ਅਸੀਂ ਬਹੁਤ ਕੁਝ ਕਰ ਸਕਦੇ ਹਾਂ. ਅਸੀਂ ਆਪਣੇ ਪੇਰੈਂਟਸ ਦੇ ਨਾਲ, ਸਾਡੇ ਜਿਹੜੇ ਘਰ ਬਜ਼ੁਰਗ ਨੇ, ਸਾਡੇ ਬੱਚੇ ਨੇ, ਅਸੀਂ ਉਹਨਾਂ ਨਾਲ ਟਾਈਮ ਸਪੈਂਡ ਕਰ ਸਕਦੇ ਹਾਂ. ਸੋ ਘਰੇ ਰਹੋ, ਸਵਸਥ ਰਹੋ. ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ.
Hi, Namaskar. I'm Sunil Gavaskar, and I'm here to request all those who are watching this video to observe a few things. Please maintain personal hygiene. Please avoid gathering in places, because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel. Believe me, that's the hardest thing for me myself, because I am on a plane every third or fourth day. But here I am cooped up in my house for the last 5 to 6 days. So please try and avoid unnecessary travel. And if you feel sick, then get yourself tested. And if you can't get yourself tested, at least observe self-quarantine so that you don't mingle with the rest of your family till you get better. Above all, do not panic because the situation is under control. The government is doing all it can to make sure that it doesn't spread, but it needs all your help to do so. So let's all do what we can to try and avoid the spread of this pandemic. This is one of the biggest challenges that we all face, and we must rise to combat it. We can do it. Jai Hind. God bless.
Well, that's all we have on this news bulletin. Stay home, stay safe, and take care.